All right, well, hi everyone. Welcome to the COVAC Town Hall on Disparities in School Reopening. Thank you so much for giving us your Tuesday evening. We have four amazing panelists here to talk about school reopening and disparities and what we need to think about and what we can do as we move forward during this pandemic. Just a little bit of information about how this town hall is going to go. From about 5 to 6, we'll have some questions that is already sourced from the COVAC group to ask our panelists. And throughout that time, if you could, and there's I see there's a little thing in the chat about this, but just to reiterate, if you can send any and all questions that you have for our panelists on Twitter at COVACMA, or you can directly chat the COVID-19 Action Coalition here in Zoom, your question. And during 6 and 6:30, we hope to answer those questions and get to as many as possible. Okay, so I'll start by introducing myself. My name is Kanika Kamal, and I'll be one of your moderators. I use she, her pronouns, and I'm a second-year medical student at Harvard Medical School and an advocate for LGBTQ+ health and well-being. And additionally, I'm currently working as the Disparities Liaison and writer for the COVAC Reopening team. And I'll let my co-moderator introduce themselves.
Hey, hi, my name's Casey Orozco-Poor. I use they, them pronouns. So at the beginning of this talk, we wanted to do a land recognition because I know that that's a topic that's been in people's minds, and we just wanted to go ahead and model that for educators that may want to do that in their classrooms. So before we begin this town hall, I would like to take a moment to acknowledge, I put myself location-wise at Harvard Medical School. So I would like to take a moment to acknowledge that Harvard Medical School is situated on the traditional territory of the Massachusetts Nation and Pawtucket Tribe. I would like us to recognize and respect the traditional custodians of the land and waters on which we meet. We honor their elders past, present, and future. And there's also a really fantastic app called Native Land. I'm gonna post that in the chat now, where you can look up where you live, and it'll show you the indigenous people that live in that area, as well as websites that can connect you to their resources. And then brief introduction for me. I'm a third year at Harvard Medical School. I've co-directed the American Medical Student Association Transgender Health course and have presented on LGBTQI issues, including intersex rights, non-binary trans mental health, and transgender clinical guidelines. Okay, great. So now we're going to go ahead and introduce our speakers. So Dr. Nicole Brathwaite is a nationally recognized board-certified adult, child, and adolescent psychiatrist and CEO and founder of Well Mind Psychiatry and Consulting Company, PLCC. Her expertise in perinatal and postpartum mental health, trauma-informed care, telepsychiatry, mental health and communities of color, school psychiatry, implicit bias, and racism and mental health. So we're really excited to have Dr. Nicole Brathwaite with us today. The next speaker is Dr. Alex Kroglian. He uses he, they pronouns. So they are the Director of Education and Training Programs at the Fenway Institute, an Associate Professor of Psychiatry at Harvard Medical School, and Director of the National LGBTQIA+ Health Education Center to improve care for LGBTQIA+ people in health centers nationally and internationally.
And I have the pleasure of introducing Dr. Elaine McNeil-Gurmai, who uses she, her pronouns. She's an elementary school principal and school advocate with a BA from Boston College in English and Sociology and a minor in Black Studies, a Master in Education from UMass Boston, and an Ed.D. in Educational Leadership for Social Justice. She has advocated for diversity, equity, and family engagement in urban and suburban school districts over the last 20 years. And finally, we have Ruby Reyes, who uses she, her pronouns, and she's the director of the Boston Education Justice Alliance, which works with parents, students, and educators to ensure Boston public schools continue to exist and serve income-insecure families of color. She spent 10 years with the City School, a social justice youth education nonprofit, as a development associate and co-executive director. So with that being said, I think we can get started with the first question, which I want to pose to all of our panelists, and we can just start in order, if that's okay, starting with Dr. Brathwaite, going to Dr. Kroglian, Dr. McNeil-Gurmai, and then Ms. Reyes. So the first question is, what are your biggest concerns regarding school reopening and vulnerable youth populations?
Thank you again for having me. So I will specifically discuss African American or Black youth. And I have so many concerns, both with school reopening and just existing right now in the world in general, given all of the turmoil, the disproportionate impacts of COVID-19, and then also the national discourse and discussion on race and racism. But specifically when thinking about Black kids returning to school, there's a lot of data out there that shows that African American youth tend to be disproportionately disciplined, so they receive harsher discipline, are more likely to receive out of school suspensions, and about 60 to 70% of the kids referred to law enforcement are Black and Latino kids. And so I'm worried that kids who already are experiencing trauma more so now than ever because of COVID-19, more likely to have lost a family member, more likely to have lost income or had significant social and economic stressors, then they're dealing with watching the news or seeing images of yet another innocent Black individual being murdered on screen. And then they go to school having experienced this trauma, already kind of being on edge and being more reactive, and then entering into an environment that already tends to discipline them more harshly rather than support them. And so one of my concerns is that a lot of Black kids will be coming into school more traumatized, more afraid, more anxious, and rather than receiving support, they may face discipline. And that, in fact, is even more traumatizing. And so it's really important that schools, just as much as they're planning for COVID and masks and sanitation, they're also planning for how are we going to support children who have experienced trauma. And I always say, just assume every child has experienced trauma, but understand that Black children may have experienced significantly more trauma. And so when we're thinking about becoming trauma-informed schools or trauma-informed individuals, we have to also consider equity, meaning that we're going to look at each child as an individual and give that child what they need for support. And so that's, you know, just kind of the start of what I'm worried about.
Thank you so much.
Should I go ahead?
Yes, go ahead.
Okay, great. Hi, everybody. Thank you for having me today. And I was asked to speak specifically about experiences of gender and sexual minority or LGBTQIA+ youth in the context of returning to school in the COVID-19 pandemic. And important to note that these are experiences rooted in intersectional identities, that people are their LGBTQIA+ identities, and also living as Black or Latinx youth, as immigrant youth, and we have to take a nuanced and holistic view of the experiences that people have. LGBTQI+ youth, generally speaking, are much more susceptible to experiencing bullying, mistreatment, social isolation in a school context, with much higher prevalence of depressive disorders, anxiety disorders, post-traumatic stress disorder, substance use disorders, often as a way to cope with all the stigma and discrimination that they experience. And important to note that these kids, when back at home for longer than maybe they would normally be if they had a school day to participate in, or being away at school, may have been in environments where they were not being as accepted by their family as other kids potentially are, and may have experienced mistreatment in the context of their home. There's no winning in many contexts, right? These are kids who then go to school and experience ostracizing and mistreatment and bullying and frank violence, unfortunately, in many cases at a much higher prevalence. There are also challenges related to having community with other LGBTQI+ kids within school. By virtue of being socially distanced, it can be harder to navigate that and have a sense of community and intimacy, which GSAs and other opportunities within school may be used to allow and are less accessible these days. There are also ongoing challenges generally in school related to sexual health for gender and sexual minority kids. And we published some guidelines earlier in the spring, soon after the COVID-19 pandemic really expanded in the way that it did, around sexual intimacy and risk, and ways in which abstinence-only approaches can continue to perpetuate shame and stigma for populations that are already highly stigmatized in terms of the type of intimacy and sexual activity that they may engage in. So there is not good public health messaging right now in terms of a harm reduction approach to sexual intimacy and connection that these kids are often struggling with to a much greater degree than students who are not LGBTQI+ identified. So those are some of the challenges at play. School-based health centers can play a huge role in providing necessary health services and mental health services for these youth, but the COVID pandemic certainly has exacerbated challenges. There is also some significant reason to believe that COVID is going to be much more prevalent among gender and sexual minority people, generally speaking. And last week we published a paper in the American Journal of Public Health calling for sexual orientation, gender identity data collection among, in the context of COVID-19 data collection. I'll share that paper with you all now as well through the chat.
So speaking specifically around students with disabilities, and also I'm coming from the elementary landscape, so thinking about our youngest students, I think there are the few areas that we need to be mindful of. First and foremost, I think many of the school reopening plans, if you've had a chance to read through them, they are very complex, comprehensive documents, 50 to 70 pages long. And I think for many families, you know, the time and capacity, there's a lot of jargon in them, a lot of language to really truly understand their options in terms of, you know, hybrid, remote, full in-person, and what service delivery may look like for students with disabilities is really difficult. So I think that there is the potential for misunderstanding. And so we need a lot of outreach to families to make sure they fully understand their options. I also think just, of course, being mindful that most likely students with disabilities, unless they potentially are in a substantially separate classroom space, will have a lot more interactions with different adults in the building. And so, you know, also being mindful of exposure, they may be going from more room to room, working with multiple adults, working with, you know, mixed groups of students. And so, you know, I know that many schools, we're working on trying to keep students in kind of a pod or a group together, but that may differ for students with disabilities that may need to be in multiple groups. So again, I think just families need to be aware of what that potential exposure may look like. What are the safeguards that are in place, you know, as they transition, what students maybe are being connected with them and things like that. And then just overall, I would say, you know, at the elementary level and for many of the students, I think what families are looking for is that connection to community. They're looking to come back and make relationships. And as Nicole mentioned, what they, you know, may not be considering is how much time may need to be spent on the safety component. And so I think many students are coming back looking for that, you know, loving, embracing environment schools have been. And while they'll certainly strive to do that, you know, I think for some students, it will be very frustrating to come in and be approached with rules and rigor, especially after such a long time of not being in the school building.
Hi, so I work with mostly Boston Public School parents, students, and teachers. And a lot of I have like a whole list of concerns, mostly because I live more in the weeds of the implications of policy and everyday implementation of the schools reopening. And so for the Boston Public Schools, there's just so many things really disconcerting about the reopening plans, mostly that they're using averages from across the city versus looking at neighborhood averages. And so you have higher averages of infection rates of COVID in neighborhoods that are Dorchester, Roxbury, Mattapan, and East Boston, where 60% of students come from. And then the way that the Boston Public Schools is set up is that you have children from different neighborhoods being bused across the city to different schools. So for example, East Boston doesn't have a middle school. So all of the middle school students will be sent out to other schools across the city. And so the myriad of, you know, possibilities for infection are much larger from these populations. And you know, both city officials as well as Boston Public School leadership have indicated that they're using citywide averages versus neighborhood-based averages, so that analysis isn't happening at the leadership level, which is, I think, for me, the most concerning part. In addition, you know, a lot of the protocols that are being developed, they're being developed by folks that are not educators, that are not physicians, that don't have as much experience kind of understanding COVID. We had a town hall with a doctor Representative Santiago, who came and talked to our families about the reality of what it was like to be in the ER during COVID. And I feel like our, you know, Boston Public School leadership isn't taking that perspective or that analysis into consideration. The staff people that are developing the protocols, the person that they call the COVID czar, her name is Tammy Poost. She's a former judge. And so it's really about looking at where they won't get sued versus looking at what is in the best interest of young people. And so currently BPS has put forth this hybrid model and they've delayed the start date to October 1st, with everyone starting out remote. And so a lot of our, you know, advocacy work has been around the highest need students, so special education, English language learners, students who just haven't been able to respond well to online learning, and then K through 3 grades who really need that in-person, you know, education at that stage of development. And so right now there's only 35 schools in the Boston Public Schools that have functioning HVAC systems. And so, you know, it's just a myriad of different problems, kind of a perfect storm, if you will, that impacts families of color and low income and immigrant families the hardest. Okay, great. Well, everyone, thank you so much for your answers. We're going to move on to the second aspect of this question, which is how can parents and schools address these issues? And we could go in the same order as last time as well.
So it's, I don't know where to begin. There's so many issues to address. I think, again, thinking about rates of discipline and disparities and frankly racism that exists in the education system, I think one thing is we just have to name it. There was recently an article in the Boston Globe looking at Worcester, Springfield, and primarily communities of color where parents or families were being reported to DCF because kids weren't logging on. But then when they did a study of the state, they said about 30% of parents reported their kids weren't consistently logging on, but most of the people, most of the families being referred to DCF were Black and Latino families. And so there needs to be recognition and acknowledgement that racism exists in our education system. It's played out day to day on an individual level, but also on a structural and a systemic level, and that needs to be looked at. And so when we're thinking about trying to reduce these disparities and the academic achievement gap, and you know, essentially the academic achievement gap is looking at the performance and outcome of children of color versus white kids. And there are studies that show at baseline, pre-COVID, Black children were 2 years behind white children, particularly low-income children of color. And so if that achievement gap already exists, and then kids are walking into an environment where they don't feel safe for various reasons, and then on top of that, they're disciplined harshly, or their families or parents are referred to DCF, that erodes what little trust may be there. And so from a school and teacher's perspective, schools, even before tackling the academics, they really need to focus on building relationships with students and with families, and they need to build trust, because everyone is afraid, everyone is anxious, everyone is going to be on edge, and kids don't learn when they're stressed. When kids are overwhelmed, when they're feeling, or when they've experienced trauma or living through trauma, they can't learn. So like literally, it's almost impossible to teach a traumatized brain. And so we have to work with both families and kids to help reduce the impact of trauma using various techniques to help decrease how trauma impacts the brain so that kids can be grounded. But a part of that is they have to trust you. They have to believe that you have their best interest at heart. And so, you know, when we're working with Zoom, it's harder to make connections with kids, or when you're in a classroom and you have a mask on, it's harder to read facial expressions and read body language. So teachers will have to spend more time doing more individual work with kids and asking what they like to watch on TV, their favorite foods, you know, telling them jokes, or introducing themselves, and even being more vulnerable on the part of a teacher, making an effort every single day to recognize every single student and be excited. Like, you know, Jane, it's so good to see you today. Thomas, I missed you today. And so allowing kids to feel valued and trusted. And then when an issue does come up, if a kid isn't performing well, or if they're not signing on, you have an established relationship that's not only focused on discipline, it's focused on love and support. And so then the parent may be more willing to explain that they're dealing with something stressful. The kid may be more willing to explain that the reason they're not signing on is because they don't feel like they can learn in the environment in which they're in. And then we can start problem solving.
That was great. And a lot of the principles that Dr. Braithwaite just described are ones that will apply generally for LGBTQIA+ students as well. These are kids who often don't experience the kind of affirmation and validation at home that's needed for them to be able to thrive and perform well academically. There is a well-known study that showed that trans and gender diverse kids who had strong family support have academic achievement comparable to cisgender kids, mental health outcomes comparable to cisgender kids, less likely to down the road experience homelessness and suicide attempts than cisgender kids are. So what parents can do now in many ways isn't different than what they ought to have been doing pre-COVID, which is to educate themselves, create a space in which kids will feel comfortable disclosing their sexual orientation or gender identity to their family, and then affirming and accepting the child for who they are. There are great organizations that can help with this. PFLAG is one example that has chapters around the country and certainly in the Boston area to work with parents of LGBTQIA+ kids, parents, guardians, and families of LGBTQIA+ kids. Fenway Health, the Sidney Borum Center, has really great parent support groups as well to help with this that have gone virtual, as have a lot of the resources offered by PFLAG. The other thing to understand is that these are kids who are going to be more disconnected from LGBTQIA+ peers now than they were before. So they're not getting the kind of socialization and affirmation within a peer cohort that was easier to access prior. COVID has created real barriers to this. Schools can do, again, a lot of what they ought to have been doing before, which is to create inclusive and affirming environments for gender and sexual minority youth, which admittedly is harder to do on Zoom than it is when you're physically in a school and may have GSA office or whatever the case may be. So carving out intentionally opportunities, even in a virtual context, for that to happen can go a very long way. And proactively making resources available to kids is going to make a big difference. Much of socialization for LGBTQIA+ kids initially who don't have a lot of readily apparent queer and trans peers around them was online to begin with, right? That's often where it happens. And people will get enough validation online to then seek out in-person relationships and affirmation and community. So that developmental jump from first testing the waters online to doing so in person is getting prolonged, and people may have to continue to develop psychosocially online without the kind of access to a community locally that they had before. A lot of the principles around minority stress and trauma and deleterious effects that has on a learning brain that Dr. Braithwaite mentioned are applicable here as well. And important to name that our Black and Latinx queer and trans students are going to be having a much harder time even than our white queer and trans students are, and will require particular attention and a focus on the intersection of anti-Black racism, for example, and sexual orientation and gender identity, and intersecting stigmas and barriers to learning and thriving?
So it's a great question. There's a lot of layers to it. I guess the first thing I would say is collaboration. The schools really need to know what has been happening at home for children these past few months. You know, we hopefully had some tabs on students through the end of the school year, but a lot has happened. And, you know, that may have included health concerns, death. You know, I feel like this has been, at least in my school, probably the biggest number of students moving in or out, which I'm sure is tied to economic changes. And so I think there needs to be a lot of collaboration to start the year about where students are entering and what experiences they've had. And I think that needs to be shared collaboration across the schools and across the families. If your school is not reaching out to you to share that information proactively with them so that they can be prepared. There's an article that I'll share in the comments that as everybody was kind of trying to figure out these reopening plans, that came out, you know, thinking about what the most equitable approach was. And there was a line within it that really stood out to me that said, it is never considered in these discussions that there might be children who have felt alienated from and abused by our school system, who have spent recent months healing in the loving warmth of their families. And that just really stood out for me, that we are also making this assumption that coming back to school is going to be the best thing. And of course, we all know there's students that school is really challenging for a variety of reasons, whether it's academic or social emotional. But really, again, just figuring out what has replaced school for these students and supporting that. I think that will be important. And then just on like a very logistical standpoint, we need to take the fear factor out of what is the school going to look like, what is it going to feel like, out of the equation. And that, you know, it can be as simple as some photographs to help students know what does it now look like for a classroom to be at 3 feet apart or 6 feet apart. What do our hallways look like? What are these new signs that are going to tell you this is the upstairs or the downstairs? Some videos of school administrators and teachers. This is what I look like without a mask on. This is what I look like with a mask on. Just norming what to expect in terms of the first day will take a lot of anxiety out of it, I think, as well.
I'm always pro advocacy. So we do a ton of advocacy, and I think talking a little bit about trust, as Dr. Nicole was talking about, there's a huge distrust of the Boston Public Schools leadership that's historical as well as current. And I think for many of our parents, they've been advocating for years for particular things. The Blackstone School, for example, they have mostly Latino families from the South End area. And they've been advocating for, they won actually $11 million to have renovations done in their school last year because they have like an open concept with no doors and no classroom doors, no actual classrooms, because it's open concept. And so this year, the Boston Public Schools hasn't addressed the fact that those renovations were supposed to happen. And those parents have been fighting relentlessly to get that money that they were already promised. So I think in terms of the Boston Public School parents, students, and families, a lot of what we do is just advocacy and exposing, much like exposing racism, exposing where we've been promised things and those promises have not been fulfilled. And so, you know, we had a city council hearing on the reopening of schools where Dr. Caselius presented the plan that hadn't changed very much from July 22nd. And so there was very little changes around what the hybrid model would look like. And despite, you know, all these teachers giving parents, students, and teachers, they gave really terrible reviews of it at school committee. At the city council hearing, I think what really shifted the model was that everyone came out and gave testimony about how dangerous the model was that she was trying to implement. And I think that's what forced the hand, unfortunately, to move the reopening back, was that we knew that the Boston Public Schools wasn't ready. They have plexiglass on order that's going to be arriving supposedly on August 27th for a September 21st open date. There's no way to implement and like install all that plexiglass in 125 schools. So for us, it's about, you know, just pressuring publicly, pressuring privately, pushing families to fight for their resources, to fight for the things that they need at the leadership level, as well as, you know, at the school level. Our families, our Latino families in particular, you know, there's a language barrier there that, you know, that affects so much of what they're even being shared with. At the beginning of school closures, you know, one of our moms was telling me that everything was sent to her in English. She was expected to support her children with online learning, but nothing was translated. So even just, you know, the level of advocacy of us having to be, you know, talk to district leadership to say, you know, you really need to, your Google Docs that you're sending out, your surveys, those need to be translated. Name, nombre, that's not that hard to go to Google Translate. You know, we're not asking for you to run everything by like a translator. You know, if you're having to make decisions quickly and sending things out quickly, even just a Google Translate is not that hard to do. And so for us, it's really about pushing, not just at the individual level, but at the district-wide level, as well as the city level. Our mayors working hand in hand with our superintendent to make these decisions, and we need to know that they're being made in the best interest of our young people, of our families, and right now it doesn't feel that way.
Thank you for all those comments. I would just love to add a few more things. That little things like asking students for pronouns or indicating where like non-binary or all gender inclusive bathrooms are, or having those conversations with students can be really helpful, especially if someone's coming out of a unsupportive home environment and they're going into school and then being misgendered. There's a really great study that shows that suicidal ideation is really drastically decreased if a student, or sorry, if an individual is given one more context of a situation in which their chosen name and pronouns are used. So it's definitely like a very powerful mental health intervention to just, you know, ask for students' pronouns and make sure that they're able to go to the bathroom in a way that's comfortable for them.
Thank you so much, Casey, for adding that. And thank you everyone for speaking at large of all those issues. And I think everything that everyone has mentioned is spot on. And going off of this, we have a few more questions, and we'd like to now just pose it to the general group of panelists, and whoever feels passionate about the question can feel free to speak up. I think 1 or 2 people per question should be great. And so our next question is, how do you weigh the risks and benefits of in-person versus virtual learning for these particular populations? And specifically, how do we feel that the risks/benefits are different within these different groups? Black communities, Latinx communities, queer communities. I would love to hear from a variety of people on this question.
That's not a loaded question at all. That's not, no one's worried about that. I mean, I feel like right now that's every parent's struggle is, am I making the right decision? Do I do in-person? Do I do hybrid? Do I, you know, do full, you know, in-person every day? And as we know, that if you look across the state, there's differences based on income level. There's differences based on communities. Communities of color are right now tending to be more remote. Private schools are tending to offer either all in-person or hybrid. And so some of those decisions aren't available to people because the decision has been made. But for people that do have those options, there's so much to consider. So again, thinking about families of color, specifically Black families, it's not an easy decision because we are, again, more likely to die from COVID. We're more likely to have negative outcomes from COVID, and it's connected to having comorbid illnesses like hypertension, diabetes, heart disease, and many of these illnesses have been directly connected to experiencing racism. So the more trauma, the more racism, the more difficulty you experience in life, it builds toxic stress, which is like all of your stress hormones being persistently elevated, that leads to chronic disease, and chronic disease leads to all of these other things that are causing Black people to die. And so when you're thinking about sending your kids back to school, you have to think about the fact that they're at risk. They're more at risk than their non-Black classmates or their white classmates, and the same with Latino kids. And so for some parents, when we're having this discussion, they're saying, as much as I need my kid to go to school because I need to work, it's also life or death. And so when families are considering this, there are many Black families that live in multi-generational households. So for me, my mother and my father-in-law live with us. So we already knew that we can't send our kids to school because we have more vulnerable parents. And there are other families that rely on grandparents for childcare, rely on grandparents for support. And many Black families have lost generations of people because of COVID. And so that fear makes it more difficult. And then also going into an environment where it doesn't feel secure. There are a number of schools, Boston Public Schools, where kids told me they didn't have toilet paper. And so it's hard for a parent to believe that if the school wasn't providing toilet paper, or if the water fountains still have lead in the water, that these schools are going to be able to adequately protect kids and do all the necessary sanitation. And so because of those fears and maybe not understanding or not having the answers, many parents are choosing to stay home. I feel like it's an individual choice. There's risk no matter what. If you do decide that you're going to send your kids to school, well, you need to start practicing with the masking and the face shield, because you need the eye protection and the mouth and nose protection, and practice 2 hours one day, 4 hours, 6 hours, and really getting the kids used to that, because kids are kids and their fingers are everywhere. And we really have to work with them to not do that. And when they come home from school, take all their clothes off, take a bath, wash their hands, don't wear their shoes in the house. And there's going to have to be a routine that you'll have to establish because of the risks that do exist.
Yeah, that was super helpful. And interestingly, with LGBTQI plus kids, it's going to be very case by case. There are kids who have a really hard time with their family, who may not be accepting of their identity, their sexual orientation, their gender identity, or their gender expression, where school has been a total haven, where they have friends, where they get to be themselves. They may be out in terms of their sexual orientation at school, or they may be more affirmed in their gender identity and be able to go by their correct name and pronouns at school and not at home. And then in other situations, kids may be getting bullied terribly in school, may have teachers or staff who misgender them or are not affirming in one way or another, and they may have a very safe home environment, an affirming home environment, and even having to travel into school can be scary for some kids who have gender expansive expression, for example, and have been harassed on the subway or whatever the case may be. So there's going to be a lot of variability. It's not a one-size-fits-all solution in terms of whether people feel safer and more affirmed at home or at school. And schools really ought to think about the entire context of any given kid's life in that regard and gauge conversations with family accordingly. Of course, there's the additional complexity that kids may not be out to their families, and it may not be safe for their families to know about their sexual orientation, gender identity, expression. So it really needs to be a situation in which the child is in the driver's seat, so to speak, and is able to express what they feel safe with and what their home situation is and what their school situation is, so that the adults involved at school can be very tailored and sensitive in their approach.
Okay, I think then we can move on to the next question. So we also wanted to talk about how masks, social distancing, other restrictions, and changes of life can affect anxiety and socialization, and what steps the school might take to help mediate some of that anxiety that people might be experiencing.
I can start on that one. So when I think about masks, I actually, there's so many different images and jokes and things around remote learning and virtual learning floating around. And one that a friend shared with me had a picture of a class, and all of the students are running around doing different things with their masks. And one of the kids is pointing at another kid and saying, "You have a cheap mask." And I was like, oh my gosh, I didn't even think about that. Like, that will be the new thing of, I have a designer mask, or I have this mask that matches my outfit, and you have a cheap, you know, the mask that the school gave you. So, you know, I just think like already the masks are going to create some difference and create some separation, but that's just one more component to it. But I think, you know, just on the basic level of what it will mean, you know, day to day, we do rely so much on our facial expressions for communication. And I think teachers in particular, I'm sure you've heard every teacher, or you've had the teacher that gave you the look and you knew that meant, you know, straighten out or stop fooling around, or, you know, I'm going to call on you next. But I think educators really rely on their facial expressions while teaching. And so taking that out, I think will really impact them. And even, you know, just on a more basic level, I know that many of our reading teachers or foreign language teachers are really worried about visually students being able to see, oh, I'm making this sound with my mouth, this is the way my tongue forms around it. So I think, you know, we really do have to think about the impact of the masks day to day. I also think, you know, in terms of social distancing, and because many of us are either starting in remote or likely will end up remote, I think there's a lot of work to be done to make sure that the virtual space is welcoming. I interestingly had one teacher who her first day teaching as a maternity leave teacher was our first day of the school closure. And at the end of the year, when we checked in with her to talk about how it went to join a class brand new in the middle of school closure, one of the interesting things she mentioned was that she never shut off the chat feature in her class, where all of the other teachers were telling us, we got in, you know, we set expectations, we shut off the chat. And so I think we really need to work with educators to balance the voices. I think it's going to be very easy in these virtual spaces to cut off the socialization, that their voice is the main voice, they have their information to get across. And so I think we need to figure out how to use the chat, how to teach the educators and the students about how to share that airtime effectively to make sure that socialization is still happening in these new spaces. We're not going to be able to have, you know, the collaborative small group activities that we're so used to happening in schools. It's just not going to happen in person at 6 feet apart, but it can happen in these smaller spaces virtually if we put the tools in place in advance.
I'll just add one thing, and thank you, Elena. Those are all great points. The only thing I'll add is, because there's so much loss of control for kids, it's great if we can give kids back some control and make them feel like they have a say in what's happening. And so one thing that both parents and teachers could do is ask kids, well, what does a safe classroom look like for you? What does a safe virtual classroom look like? What does a safe in-person classroom look like? So there's certain things, especially kids who've experienced trauma, they're more looking at what you do and less listening to what you say. And so not being able to read those facial expressions can be really difficult for them. And so for those kids, like what makes you feel safe? What can we do in this classroom that makes you feel safe? The rules, can these rules be collaborative? So rather than just saying, these are the rules of the class, this is what has to happen, can we have a discussion about, what do you guys think about eating during Zoom? Do you feel like we should or we shouldn't? Like, you know, can we, you know, even have a vote on it? Let's have a discussion about it. What do you think about some kids that wear their pajamas to class? Does that feel safe? Does that not feel safe? Does it matter? Can we make these rules together? And there may be certain things that we're not even thinking about, like not having or not having the chat on is not even something that I would think about. But some kids will say like that, you know, I want to be able to ask questions, but I don't like being seen on camera. So having the chat is really helpful, because then I can communicate without having to like talk or, you know, whatever, or teachers that demand the camera be on. Maybe you should check in with each student before making that rule, because they may not live in a home where they feel comfortable having the camera on, or not allowing kids to have backgrounds. That may be a way the kid can turn the camera on, is because if they have a background, then you don't see the rest of their environment, and that's how they feel safe. And so a lot of collaborative problem solving will help decrease some of the anxiety, and kids will feel like these are my rules, this is my classroom, and by taking ownership, they're more invested in the learning process.
I just kind of want to echo some of the social pieces. Most young people learn through social relationship building. You know, they're able to see themselves in a curriculum, or they have their favorite teacher, or, you know, they go to school to see their friends. And so with that piece shaken or missing, I think really developing the social pieces of it are really important as well for the virtual learning. So even just giving time for young people to log on before class to like see their friends, or, you know, having a specific time of the day where they can just go on and like talk to each other. My partner's 7-year-old daughter, they had an 11 a.m. every day where, you know, it was just like all these 7-year-olds like talking at the same time. But it was, you know, the best part of her day was like seeing her friends. And then also just being able, I think, to share more information with one another. So really making sure that young people have access to one another. You know, she's a 7-year-old and she's emailing her friend on a daily basis, and they sometimes have Zoom meetings, you know, during the summer. And they, you know, it's not class related, but I think for young people, most of the adults forget that most young people really only learn through social interaction. Like they're only motivated to go to school literally to see their friends. And I think, you know, for English language learners in particular, that piece of being immersed in another language is also going to be greatly missed in terms of them going to school and you know, not being able to speak their language, you know, having to learn and hearing it on a daily basis. And I think that's going to be really hard to replace via the virtual learning.
Just 15 seconds. I know we're up to four people already instead of the 1 to 2. I shared an article about sexual health in the COVID-19 era in the chat. Schools struggle with sex education already, and sexuality is fraught for adolescents as it is. In the context of this pandemic and social distancing, that's even more complicated for people. It's challenging developmentally for youth who are discovering who they are and potentially a sexual minority identity in that context. So schools can really be thoughtful about how they discuss sex education in this context, because adolescents are not slowing down. We're seeing PrEP prescriptions decrease, but incidence of STIs and seroconversion has not decreased at all. So we need to not assume that kids aren't engaging in sexual activity, because they certainly still are.
Thank you so much, everyone, for sharing such great and important points. I just want to shift gears now. We just talked about how we can best support children and their mental well-being and their physical well-being at school, but I wanted to ask, what solutions can you offer when families that need in-person learning to continue working have children who may be more vulnerable than their peers? For example, how do we create a more equitable classroom when some families can afford at-home tutors and others cannot? How can we extend resources to children who need additional support?
I can talk a little bit about what we've been hearing or what we've been talking to BPS families about. Most of the folks that really need in person are those that have young people that are high need. And so currently the model or the policy that's been put forth is that there's a 4-day option for young people that need it. But unfortunately, they haven't identified who those young people are, and that model will only be available after families have selected remote only or hybrid. So it's kind of like whatever's left over is the 4-day option. So it's, again, I tend to live in the weeds of policy because that's what tends, you know, the devil's in the details, and that's what tends to hurt our families the most. But for us, it's really for families that really need in person, especially those with young people with high need. It's really about making sure that there's advocacy at the school level, and making sure that their teachers, that their principal, that everybody's kind of at this table of making decisions on a regular basis. And also the school nurses, they did a wonderful job of putting together guidelines for the district in May, and they presented them in May, early May, and they were not really, you know, taken into account. So really just thinking about, you know, this individualized school community and how these school communities are going to respond to what's needed in person for safety along all lines. And so, you know, policy-wise, for us, it's about pushing those details and making sure that things are ready, that our school buildings are ready. Oh, and the other thing, I'm sorry, I also wanted to just comment on the fact that the Department of Elementary and Secondary Education also put forth school learning communities as happening in school, in community, and in the home. So a lot of times families think that they need to have in-person learning solely in a school building, when we know that a lot of our school buildings are not safe. And so also being able to advocate for the fact that they want their in-person services, they can find a community center that is up and functioning. I know the Dorchester Y, for example, they opened their doors for essential workers for childcare as the pandemic started to get terrible. So really looking at these community resources that have kind of been able to do in-person work so far, and pushing families to fight for those services to happen in those community spaces or in their homes that they know are safe. And I don't always think people highlight kind of like that triad of location.
I would just add to, you know, thinking about that, I think there's obviously been a lot of conversation, you know, about forming these learning pods and, you know, potentially the higher economic levels, that's forming a learning pod with a private tutor or a private teacher. But the reality, unfortunately, is that we, you know, some families may not have a choice. However, schools could still close again. And so I would definitely encourage, you know, we all were at a loss with the school closing before, but if it closed now, you know, we have some time and capacity to try to make some connections. So, you know, I would encourage all families as schools open. I know I've had a number of requests of, can you send out like the class list early, you know, can you send the list of all the remote kids to us early? So I think, you know, connecting with the school to find out how you can connect with other families. And it's not perfect, of course, but trying to find maybe 2 or 3 other families in a similar situation, taking similar precautions to your family and creating your pod. It doesn't have to be around finances. It can just be around families supporting one another that live locally or have kids around the same age. I'd also echo what Nicole said. We really need to support students in understanding how to protect themselves going into the building. I think this is true of us as adults as well, right? I mean, it's very hard to social distance when somebody gets really close to you and you have to say, I'm trying to social distance, you know, can you stay 6 feet away or whatever it might be. And so really talking with children and preparing them to wear a mask. You know, I can tell you that the biggest concern for teachers is if they're trying to social distance at 6 feet, but have students who need help with the mask or don't have the mask on. And so, you know, their comfort level in getting very close to your children and supporting with that is still going to be pretty low. So we really need to support children in advance with the PPE. And if you do have a child that may have a disability that's not able to wear that, again, you know, proactively finding out from your school what the safeguards are. The guidance from the state said students could be at 3 feet apart from one another. Many districts felt that that was too short and went with 6 feet, which has been the kind of the typical guidance we've heard. So maybe, you know, again, inquiring, what does that look like in your district's reopening plan? Is my child going to be 3 feet away from other students, 6 feet away? Can I request that they're 6 feet away? And just really asking questions if your child is not old enough or able to advocate for themselves. But I think it's preparation, because unfortunately we will likely be remote again at some point, and we want to make sure that transition is as smooth as possible.
Okay, thank you so much for answering that question, everyone. Our next question is a very understand if thoughts about this aren't well formed, but we definitely want to hear your thoughts. If schools are forced to close again after an outbreak, how do you recommend this second transition taking place?
You guys, all these easy questions, they're just like so straightforward. I mean, I think it kind of goes again back to equity. I mean, in terms of transitioning, hopefully we would have learned and hopefully kids would have adjusted, but I think we just also have to think about what each child has to deal with at home. So I'm originally from Philadelphia, and when this all first started, the superintendent of Philadelphia, his answer was, well, we're not going to do online learning because there's so many impoverished kids in Philadelphia that they just don't have computers, they don't have internet, so we're just not going to do it. That was his answer. Like, we're just not going to teach them because they're too poor. And so there was a lot of pushback, and finally they agreed to give a Chromebook to each family. But then what they didn't take into account was there may be more than one child who needs to be online at the same time. And at least 30% of Americans don't have access to high-speed internet. And as we know, even those of us who have high-speed internet, if 2 or 3 people are on the internet at the same time, it doesn't matter how fast you think it is, everything is like pausing. And so when we're thinking about transitioning back, particularly for families that have multiple kids who are online at the same time, we need to think about how we're going to schedule things and understanding that, not all kids can be online at the same time. And so if 2 kids have classes at the same time, teachers need to work with the families about how to get that information to one of those children, or how to straddle the timing so that maybe the session is recorded and they can watch it later. Or also understanding that not everybody has the high-speed internet, so it may take longer, and maybe videos that they have to download won't be the best way to teach because they can't do it. Maybe YouTube is a better option. And so we're going to have to be very creative, but also thinking about equity and understanding that not every home is the same, and we will have to be flexible. And I always say this, since COVID-19 started, everyone's having a hard time, and we all need to be more forgiving, and we all just need to be a little bit more willing to give people a break. And I'm hoping that teachers will do that, families will do that, because kids are struggling. Yes, education needs to happen, but it will not happen if everyone feels overwhelmed.
I completely agree about the social piece of it. I think teachers who have the most direct contact with students and families really need to be given space and time to reach out to families, to be able to talk to them, to make sure that students have that kind of individualized communication with a teacher, and just building that into the rules and the curriculum of kind of the new normal. And I don't necessarily think that that's happening in a concentrated way, but really just acknowledging the fact that that type of relationship building needs to happen, and it takes time, and allotting for that time.
Thank you both so much. So we're going to end it with a question that I'd actually like to pose to everyone. And that is, what are the most pressing needs that COVAC, the COVID-19 Action Coalition, should be advocating for to support the academic success of all children? And maybe if you could just list maybe your top 3 to 5 priorities that you think that we as an organization should really be keeping in mind as the process moves forward.
I can start. So I think the point about technology is well taken. What we're hearing now, a lot of districts have stepped up and said that they will ensure that every student has a device. Many districts are either also purchasing hotspots or devices that come with Wi-Fi built in. But we are also hearing that there is an incredible back order on these devices. And so I think that many families will start the year with the promise of technology and not have that. So I think this is, again, maybe where some of these community opportunities may come into play. You know, whether it's the YMCA or the church hall or you know, the community center, but we likely will need more spaces that have some stand-in technology for students who will not have a device at home. So I think finding out where those locations are and getting that messaging out or supporting the provision in those places would be really helpful. I think that would be key. And I think, you know, again, these reopening plans are very comprehensive. And so continuing to provide families, you know, really with like one pagers of these are the best practices to prepare your child to be safe in schools. These are the questions you should ask. These are the things you should be aware of. I think would go really far compared to these more lengthy documents.
I think it would be, I mean, I'm a member of COVAC, so it's, I don't know, I have a little bit of a bias, I guess, but I think it would be great to try to, kind of as Elaine said, produce information for schools, for parents, and for families that is straightforward, because every single day there's a new article that comes out that contradicts the article that came out the day before. And people are just so confused that, well, are kids more contagious or are they not more contagious? Okay, so they have higher viral loads, but what does that mean for my grandmother? And so because there's just, and the evidence is changing and the information is changing, like, well, should my kids be taking vitamin C every day before school? Or should they be, you know, like, does it matter if they take, I heard it was bad to take vitamin C. And so I think it would be great to just have like, this is what we know so far. These are the facts. These are the concrete steps that you can take to protect yourself and your family. And if we're able to produce that in multiple languages and having it just be very clear and straightforward, both for parents and for teachers.
I would echo that and just say that a lot of, you know, the Boston Public Schools has all these protocols in place, maybe just putting out a summary of what, you know, what should happen or what are recommendations that should happen if a child is, you know, showing symptoms, and being able to create kind of that template for best practices, because there is so little information, and most of the folks that are making these decisions don't have medical backgrounds. They have, you know, they sometimes don't even have education backgrounds. So really being able as a medical community to be able to implement these recommendations and in multiple languages, I think would be such a blessing for many of our families. And then also just weighing in on things. You know, I always push for advocacy on all levels. If there was ever a time for you to find your voice and not be silent, this would be the moment, you know? We've really just pushed so hard at the city level, at, you know, the BPS level for different things, and we've seen some shifts, but it required so much effort of advocacy from parents, from students, from educators. The bus drivers union talked about losing 4 of their drivers to COVID. So that it's just undeniable at this point, you know, what is happening. And I think for school leaders who want to live in this place of denial, it needs to be shown that it's undeniable what needs to be done. And so I think, you know, if there was ever a time for you as a medical professional to say, you know, I looked at the BPS website and this just doesn't seem right, or I'm looking at the Lowell School District and, you know, these protocols don't make sense. There are plenty of spaces to be activated right now, because the reality is that where you live and where you work, that, you know, it's impossible to say, well, just because you're in the Lowell area, you know, you have teachers that live in Lowell that come to Boston to teach. You have children who are, you know, in different places coming to Boston to go to school, that are traveling across the city. So I think living and working and thinking about how we travel across Massachusetts, it's impossible to say that, you know, you're gonna be okay in Wellesley, you know, it's just impossible. And so I think if there was ever a time to really push and be activated it's now.
Yeah, I would also just add that in the context of this pandemic and what an extreme set of barriers it puts in place for kids to be able to get an education, particularly for key populations of children and adolescents that we're talking about today, it's very easy to fall into a pattern in survival mode of getting very concrete about the technical logistics of how to keep kids learning online, and what often falls by the wayside are psychosocial and mental health needs that are at least as important in terms of the experience developmentally that kids are happening. I don't remember some fact I learned, in the 7th grade about the War of 1812, but I remember everything psychosocially that was going on for me at that time, and my own identity development as a minority kid. So we really have to proactively ensure and insist that we're getting as creative as possible about meeting the psychosocial needs of our kids and the mental health needs, and not get so tunnel vision about technologically how we're going to continue to transmit facts to their brains that we lose sight of the critical developmental experiences that they need to continue to have.
Great, thank you all so much. So next we're gonna move over to some questions from the audience, but before that, just in case anyone needs to leave early, we wanna give a brief announcement, which is that the Coalition is advocating for Massachusetts to provide free surveillance and symptomatic testing for teachers, students, and staff at schools across the Commonwealth. And if you're interested, I'm about to drop a link in the chat to our letter to Governor Baker, and if you support this cause, we'd love if you could sign on to our letter. And we feel like this is a critical initiative and one that is key to opening our schools safely and, in light of the topics of today's forum, one that is essential to equitably fight this pandemic in all communities. So I'm just gonna send that link in the chat right now. Okay, great. Yes, and as Karen said, please share with your networks, anyone who you feel like might be interested and would support the cause. More people, the better. Okay, so it seems like we have only had one question in the chat or over Twitter so far, but if any more come in as we're answering this one question, please feel free to speak up. So we have a question from Tiffany, and it says, what would it look like for our Black/queer/immigrant/generational and COVID trauma students to have support? Is it having a social worker, trauma-informed volunteer on each Zoom or class? Do teachers have the direction to contact the health centers on a weekly basis to check in and refer any children that might need support? Are there other action allies/community builders that can do this and help our students as well? I know we've touched on this a little bit, but if anyone has any additional things to share.
Great, that's a great question. So one thing, there's so much evidence looking at how to support kids who have experienced trauma, and one of the most effective interventions is a child having a safe and supportive adult in their life. So an adult who accepts them for who they are unconditionally and is fully available to them. And just having a safe and supportive relationship with an adult can build resilience in a child that otherwise would not have had that resilience. And so having positive experiences, developing, learning safe relationships, learning how to engage in safe relationships in itself is protective. And so one thing teachers can do, one is educate themselves about trauma, how trauma impacts the brain, what it means to be trauma informed. There are a lot of websites out there that talk about trauma, even throughout Massachusetts. There are a lot of studies, even specifically understanding how racism is trauma. There's a great website called Teaching Tolerance that has a lot of curricula about racism and understanding that impact. So one is educate yourself, and not even just teachers, any individual in a school that is child facing or has engagement with kids at any level should understand trauma, because that child's person could be the administrative assistant. That child's person who they connect with could be the janitor. And so every single person should understand trauma, and every single person should understand red flags and know when kids may need referral. So I think that's the first thing. It shouldn't just, because we just don't have enough resources. We don't have enough school nurses, we don't have enough school counselors. And I guarantee when school starts, they're going to be overwhelmed because kids are going to come back with a lot of difficulty in making this transition. And frankly, adults are going to be coming to school counselors because they're going to have their own difficulties. So teachers really need to be aware of their own trauma and how to regulate their own emotions, but then also how to support kids. So that would be the one thing, developing relationships and then educating yourself about how to become trauma informed.
I would just add on to that, you know, many schools either have, you know, a student study team or student support team, behavioral health team. And to Nicole's point, you know, ideally schools are using that as a team that all the other educators in the building can bring questions and concerns to, because it can't solely function, you know, on that one group of 5 or 6 individuals or on the adjustment counselor. I think there's a lot of education to be had at the beginning of the year. You know, the question asked if teachers have direct contacts to the health centers. I think what teachers have the direct contact to is knowing that they're mandated reporters. And I think that's where the concern can arise, that they may hear something or have a concern about a child. And we are mandated reporters, which is an incredibly important role. But having some support of where do I take this concern, you know, as Nicole mentioned, there was that recent article about reporting to DCF, and in many situations, families in that article mentioned that there were language barriers or they didn't have the technology. So we really need some group to funnel the concern to say, okay, so, you know, Johnny hasn't been on in 3 days. Have we called? Is it the technology? Has something happened in the household? So I think making sure that those are in place in every school. And again, on the proactive end, having families advocate for their child if there's a concern, so that it's known and doesn't bubble up to something new, so that that child can be entered into conversation and strategized around and supported further, I think will be key.
I mean, I think language justice is always an important factor. You know, making sure that things are translated, making sure that the families have access to information and understand what's happening, and really just advocating that items be translated from the most basic document to the most complex emails, everything.
So I would actually love to respond to that question as well, as a student, as someone who uses they, them pronouns and who is like Latinx. I would really encourage, like what Nicole was saying earlier, making those one-on-one connections with students and not referring mental health crises out to make yourself feel better about it, and really challenge yourself to form those one-on-one relationships with your students and see what you can do for them and where they're at, because you don't want a situation in which students are afraid to demonstrate depressive symptoms or anxiety symptoms if they know that it'll be a referral out to someone that they don't know, they may not trust, and someone who might make them feel unsafe. And it also needs to be stated that the carceral functions of psychiatry, like we have like 2 of my favorite psychiatrists ever on this panel, like they're spectacular, you know, like they're working against a lot of these like carceral systems that cause people harm. But the field of psychiatry, the field of mental health, the field of social work is not separate from the carceral industrial complex. And we need to be very mindful about who we send students to, how we do that, because it can be very jarring for a student to begin demonstrating mental health symptoms and then be sent to like the principal's office because he did something like bad, like self-harm, for example. So really just emphasizing fostering those one-on-one connections as opposed to like blindsiding students. I also want to say that although like there's so many amazing suggestions offered by the chat, we don't want to like over-treat students, because if the issue is that they're so stressed that they're not able to focus in class, will a once weekly counselor session, more talks with their family, you know, more talks with like the nurse staff, like we don't want to overwhelm students in trying to treat them. We want to make sure their schedules make sense. We want to make sure that care is coordinated and efficient and matches what the student needs. We want to make sure that we're respecting that parent confidentiality. Some, students aren't out to their parents or aren't comfortable speaking with their parents about things like self-harm. So just really centering the student as opposed to the structures, I think, at least being like a vulnerable student who's dealt with mental health things, it's really important. And I would have really appreciated like one-on-one connections just throughout my time as like a queer Latinx student. And we have one more, oh, thank you, Dr. Coglian. One more question. There was a comment about concern about increased use of substances by young people as a means of coping. I would also like to add on to that kind of like a potential disciplinary component of that. And like in our like collective quest to not scare students or like overly police them, like how to navigate that as educators. I think I'd be really interested to know that as well.
I want to echo and agree with everything Casey said, and what they were describing and how I think about the question about substance use is that we as the grown-ups in the room or the virtual room have to monitor and have more control over our own reactivity in response to things that students say that may otherwise freak us out, right? Because if we're gonna freak out and overreact to things that they tell us, that's not anchoring for them, that's not grounding for them, and that doesn't give them a sense of stability and a sense that everything's going to be okay. So a lot of what we have to do as grown-ups is hold their distress and show that we're not fazed by what they're sharing with us and that we're going to be there for them regardless, and that there isn't going to be an overreaction that makes things worse because then you rupture lines completely. And that's true for much of the substance use that happens with adolescents. Of course, there are adolescents who develop serious substance use disorders that can at a certain point be even life-threatening or seriously compromise their ability to engage in school, and then you want to have a proportional response to ensure that they're safe and well. But I think this working through our own reactivity and catching ourselves doing that and keeping the drama low is something that we often struggle with. And to be fair, there are often pressures, externally, regulatory, and otherwise, to report, to follow protocols, to do this, to do that, that are there for a reason in many ways, but it's unclear that having those knee-jerk responses or kind of being very rigid in that regard necessarily results in better outcomes for these students.
I think that the increase in substance use is universal right now. I think in March or April, I read an article that there was a 30% increase in alcohol purchases than in the months prior. So not just kids, but also adults are using substances as coping mechanisms. And so certainly having a conversation. So one thing I really struggle with in schools is zero tolerance policies. I completely understand where they come from, and I recognize there has to be rules and regulations to keep kids safe. But again, zero tolerance policies tend to more seriously impact Black and Latino kids. And so suddenly the zero tolerance applies to Black and brown kids, but there's some other accommodations that can be made for white children. And so when we're thinking about how to support these kids, not thinking about punishment as our first response, but thinking about support. So this substance use or this kid who brought in something in the school, there's likely something behind that. So let's figure out what is behind what we're seeing in front of us, because what we're seeing is just a symptom. So what's the cause of the illness and ways that we can support kids. Now, again, obviously, some kids, bring things in or they're selling them. These are obviously things that we have to address. But if it's a first incident, or if it's rare, or if this kid is exhibiting symptoms in other areas where their grades are dropping or they're more irritable, it's likely not just the substances, something else is going on. And so in the same, and this is replicated in even in the court systems when Black and Latino people come in with drug charges and with white individuals come in with drug charges. Black and Latino people are given very harsh sentences and white individuals are often sent into dual diagnosis treatment programs. And that's replicated in the school system and it just continues into adulthood. And so we need to cut the school to prison pipeline. We need to end the system where we're funneling Black and Latino kids into the school to prison pipeline and then cutting off their opportunities. And so finding other ways to support these kids because treatment is available. And this is a great area. This is a great place where you can utilize the social workers or utilize the BEST team if you're in Boston. And I used to work for Riverside. They have a team that can come out. So this is when you can utilize these resources if you feel like a kid needs more support rather than punishment or prison.
In BPS, we currently have an information sharing policy that's being voted on, in which students' information is being shared with the Boston Police Department. And so just really thinking about some of the things you were saying about the school to prison pipeline and how particular policies feed and perpetuate that pipeline and kind of enhance it. And so, you know, we've been working with particular different activist groups to ensure that there's monitor and oversight. But yeah, so that's one of the policies that will be voted on in the next school committee meeting on September 19th or September 16th, I think, if anyone wants to join in, tune in to the Boston School Committee meetings. But it mostly came to light around information sharing that got 2 children deported from East Boston, 2 Latino students. But it affects, you know, so much that that these reports can be written up by police officers that are in school, and then they're shared with you know, the FBI and with ICE and these higher federal agencies, and not, you know, of any choice by the BPD of their own supposedly, but just that, you know, with Homeland Security, that, you know, the federal government can come in and look at whatever they want to look at in your police department's files. So it's just another policy that's impacted young people of color in a variety of different ways.
Well, thank you so much for responding to that very difficult question. And it's very heartening to see that there are healthcare workers, educators, physicians out there that are thinking about these issues in very nuanced and compassionate ways. So although it's a difficult note that we're leaving off, I at least as like a student who has dealt with issues pertaining to vulnerability, I really do appreciate the 45 participants that are here. I believe it used to be 50 something. People have, you know, they're busy, they're valid. But just like the amount of people that showed up, the questions that are being asked, the really thoughtful responses from you all. So I at least know that people are gonna leave this conversation feeling a lot more directed in their efforts and know that there are other people they could reach out to or other people whose ideas overlap with theirs. So I personally am really boldened by that. And, you know, I think that things are going to be difficult, but that this community is going to continue having an ongoing conversation for how to make things better about people. And I think there's something really empowering and special about that. If there are no more questions in the chat, I think maybe the speakers can hang out for a few more minutes to see if something comes up, but it seems like this is a natural conclusion to the meeting. Well, thank you so much, everyone. I'll hang out if folks have like comments and stuff.
Thank you, everyone, for coming.
Casey, could I go ahead and ask a question before I have to hop off?
Please, yeah.
Thank you all so much, first of all, for all the time and the directness and naming everything. So my kids are not in school yet, but I am understanding that the way I advocate and the way I use my resources now will impact them as when they do go into school, and COVID, is transforming how we think and literally how we breathe. So I want to be sure, as also an ally to the Black and Brown and people of color communities, and then an advocate for social justice and equity and inclusion. Like, what some of the stuff, I'm mind blown. I just don't even understand how these systems are operating at the unfortunate rate that they are. Like, what can I do to, like, what do you want me to do? What is the most important thing I could do for these start dates for these children, or for the teachers, or for the, like, what can I do?
I think that's a great question. Thank you for your energy and your willingness to be an ally. So I think one thing is to, certainly coming to talks like this, educating yourself, understanding the disparities that exist, but using your position as an ally to advocate, and that really is one of the best things that you can do. So understanding that injustices are occurring, understanding that there's disparities in resources, like some schools are asking students to help clean up because they can't afford extra janitors.
No.
Some of our physicians have done mass drives, and there's a school, the McKinley School in Boston, a physician from the COVAC group just donated 300 masks because many of the families can't afford masks. Many of the teachers are paying for masks and supplies out of their own pockets. And so providing support to try to help minimize these vast disparities that exist. There are certainly a number of nonprofit organizations who are looking for people, not necessarily to donate money, but time and
Sure.
resources. And so they're, and voting both
Yep.
in local elections and national
Yes.
elections for people who are in line with social justice and with the goals around equity.
Okay. Thank you, Nicole.
Beja has a fund for parents and students that we collect individual donations to redistribute via Visa card. So, if you want to donate to that, it'll go to Boston. It's our website is bostonatjustice.org, and I think it's like / one of the, you can check out our website.
I'm on it now. Yep. Yeah, I was tracking you, Ruby.
So yeah, you can, and that goes directly to BPS families that are most in need.
Okay.
There's so many things to do. I think a lot of times, we do advocacy work, and parents come to us and students come to us when they're in need of particular things around their children and around their school. And we really push families to think about everyone, not just themselves. So what you're experiencing with your options, people don't have. And I think really just, naming that, if you go to school committee and give testimony, if you, go to city council hearings and give testimony, say, this is my experience, but I know that's not the same for everyone. It's completely different for so many families. And so I think that's really important, even within your children's school. Okay. So I think naming it is really important.
Yes. Thank you, Ruby.
I have to hop off too and give dinner to my kids, but thank you everyone. And thank you to everyone that came, and thank you to COVAC for planning this event, and to all of the speakers. This was awesome. I hope that it was helpful for everyone.
That's great. Thank you, everybody. Thank you so much.
Bye-bye.
Thank you.